Hello everybody, it's Kenneth and I'm back with another video, and sticking with the medical theme of the most recent videos, I've decided that I want to talk about diagnostic tools. And by diagnostic tools I really mean like scans. So that includes like MRI, X-ray, CT, and bone scans just for this video. If there's more you'd like to see, feel free to comment. I'd be happy to create a video on those as well. So let's just get started with it. Okay, so first we have X-rays. And this is probably the most common one people get because a lot of the times, well, a lot of people have fractures or they break something, and this is typically what will be used to diagnose that in a common doctor's office. So most people are familiar with this. So X-rays use ionizing radiation, which is just like high energy, as you can see, electromagnetic radiation, and it passes through the body and creates images of bones and tissues. And when it hits a tissue, that's when it like creates an image. So, like you can see that there are bones, they're white and they're clear on the image on the right, and you can see them very well, and that's because they're denser than other tissues like soft tissues, and they absorb more of the radiation, which leads to the more visible, wider image. Which is also part of the reason you can't see soft tissues as well because they're not as dense. Now, there is an issue with this, and it's that ionizing radiation over time, so say you get a bunch of x-rays over time, then your DNA can become damaged and it could lead to cancer. But as long as you're not getting them very often, it shouldn't really be an issue. And then this is typically used for things like 2D images, like what you would think, diagnosing a fracture and stuff, which I've already said. So the next one is CT scans. And as you can see on the right, this machine, the person kind of goes inside of it. They lay down, and then the like thing they're laying on, the bed, it like moves into the machine or over the area that's being scanned. And you can see below, this is an image from a CT scan. And you can see like it's like a cross section. So this uses x-rays too. It's basically an x-ray, but it takes pictures, as you can see, multiple images and from multiple angles, and it combines them to create these cross sections that you can see here. So, of course, with that too, um, the dense materials absorb more of the X-ray, so they're still whiter on the image since it's still X-ray. So, like here, I believe this is the spinal column on the back, and you can see it's still white because it's bone. And then the other stuff here is like darker because it's softer tissues. And this can create a 3D view of tissues, which can help doctors see tumors better and diagnose them and like whatever else they may see. It just can be more helpful than a 2D image. Third, we have an MRI. And if you look at the top MRI machine here in the top right, you see that it looks similar to the CT scan machine. And that's because they are similar. They both have the patient go through the machine, or part of a patient, and they're laying down. So that's how they're similar. Um, and this machine can be really loud, which can be anxiety producing, especially because it can also cause claustrophobia in patients. I mean, you can imagine being stuck in a tube like that. So I know sometimes they'll have people wear headphones for that, or they get to choose music to play, and that's really helpful for patients that might get stressed out easily. Now, um, first, before I get into the or the MRIs, the two machines here. From what I've read, the closed machine is better in terms of image quality, and that's just because they're stronger, like magnets, and it does use magnets to create the image, but I'll talk about that in a second. But the open MRI machine can be better for individuals who have anxiety because it's open. They can see more. They're not completely stuck in a machine. And then here's a picture of the brain from an MRI scan. So okay, so MRIs use strong magnets and radio waves, so no ionizing radiation, which can make it safer, to create detailed images of soft tissues. And this is better for soft tissues than hard tissues, right? The other two are better for hard tissues like bones, and this is better for soft tissues. So if you had like a brain damage, a patient that presented with some sort of like neurological symptom and you wanted to get a scan of the brain, then you'd probably use an MRI. Um, so yeah, and Halley's works, so it aligns the hydrogen atoms in your body and uses radio waves to disturb them. And eventually, once they go back to normal, they send signals back that are turned into the images you see. So this doesn't carry the same risk of DNA damage since it doesn't use the ionizing radiation energy or as high energy as the X-rays do, which is important because this can be a safer alternative. However, since this uses magnets, if the patient has anything magnetic in them or like metal, then they may not be able to use this because it would be dangerous for them. And this also produces 3D images. Now, something that I want to mention now is that for CT and X-ray, well, for all of these, there are specific like dyes that can be given to patients to like see certain things. And those dyes can cause allergic responses in patients if they are allergic, but that's rare. So, and it's like iodine dye. So if a patient's allergic to iodine products, then perhaps they'll be allergic to the dyes. But yeah, that's rare, and so not really something that should be accounted for. Of course, ask the patient. Um, but yeah, so and keep that in mind because if you're doing this for like a class or something, learning this for a class, then uh, the professor or teacher would probably want you to know that. So the final scan I have here are bone scans, and these use radioactive material, which are radionuclides as tracers. And as you can imagine, it's a bone scan, so it scans the bones. So it's injected into the body and travels to bone areas, and it travels especially to areas with abnormalities, so like osteosarcoma, like bone cancers or fractures. It travels to those areas. Well, it travels to all bones, but it travels to those areas too, specifically. This is very sensitive. It can detect problems earlier than regular X-rays, especially for the issues that affect bones, like hidden fractures or the cancers we talked about. Now, as you can see on these scans on the right, the bones are black, right? And if you go to the X-ray and the CT, they're white. And I know that when I first learned about these for class, that was a question the teacher asked. So just keep that in mind, right? Bone scans show the bones as black, and then CT X-ray show them as white. And also, for bone scans, they are normally taken over time. Um, well, sometimes they are. They can be, okay? They can be taken to show like progression over time. So like you get a bone scan done like 20 years ago and then you get a bone scan done now just to see like how something progress. But I guess you could do that for all of these. So um that's not really as important to remember. And the last thing I want to say is that for all of these, they all do use radiation. If that is a question, please keep that in mind. They all do use some kind of radiation. Like the bone scan uses radioactive material, radionuclides. That's radioactive, okay? The MRI uses radio waves, and then the CT and X-ray scan use ionizing radiation. So they all use some type of radiation. However, the bone scans and MRI are less likely to cause damage because of the radiation. So just keep that in mind. But that's really all I have for these four diagnostic tools here. So thank you guys so much for watching the video. If you have any comments, questions, please feel free to leave it in the comments. And if you like the content, please subscribe and like the video. Thank you guys.